Hello, good evening. Welcome to the room. It's Valin again, your host from Vemma, Malaysia. For those that are out of the room, if you can hear me clearly, please type 1. Thank you. Yes, thank you, Oscar. Thank you, Hasna. Right, thank you. Good evening, everyone. Right, tonight we're going to have coronary artery disease, and tonight will be the part 2 from last week's topic based on hypertension. Well, what is actually a coronary artery disease, or we usually call it as heart disease? How can our heart get sick, and how to prevent it effectively? All right, so ladies and gentlemen out in the room, are you ready? So take out your notepad, and if you're ready, I shall now pass the room to our product consultant, Dr. Ibrahim, for tonight's topic, coronary artery disease. Good evening and welcome, Dr. Ibrahim, and the room is yours.
Thank you, Berlin. A very good evening to everyone who's in the room. I was told that last week my voice was a little soft. We have changed the speakers today. I hope it is loud enough. Could you respond by typing 2 if you think that the volume is fine? Thank you, thank you. Okay. It's important that you hear what I say, and it has to be loud and clear. The topic we are looking at is heart disease. If you look at the papers, magazines, radio reports, TV reports, anything on heart disease, they will tell you a lot of figures. What it means is it is the #1 killer, not just locally, in all countries. Even in the West today, in spite of all the advancement in the treatment and prevention of heart diseases, it is the #1 killer. Now, if you ask me, I would say that is normal. All of us are going to die one day. The fastest way to go is to have a massive heart attack, and within a few minutes you're gone. Now, if death comes by any other way, it is going to be slow, painful, expensive. Just imagine you had a cancer. Now, I don't have to elaborate. It strikes terror in our hearts. It can take a few years to finish you. It can take a few months. Now, right through the process, the family suffers, you suffer, and this is really unnecessary. So nature or God has designed us in such a way that when it comes to exit, this is the fastest way. But out of necessity, we would like to live a full life till the time actually comes. So we must prevent, or if possible reduce, the severity of heart disease as much as we can, so that we live a full life till the end. Heart disease being #1 killer is fine, actually. Now let's look at the heart. We need to know a little bit about the heart before we go into the disease. Now the heart is an organ, #1. #2, it's a pump. So as an organ, it is made up of the same thing like other organs, muscles, blood vessels, nerves. But because it is a pump, we have valves. So the heart is not just blood vessel or just muscle, it has got all this. And it is very important. Now, when the heart gets a disease, it also gets diseases of the muscle, diseases of the blood vessels, the nerves, and the valves. But most of the time when we look at heart disease, we say that it is a blockage of the vessel, and we will see very soon why. Because when you take out the diseases due to the various things, you will find that you will find that 97% of the diseases of heart is diseases of the blood vessels. If you look at the previous slide, now the blood vessels form only one of that, but that alone forms 97% of all the blood diseases of the heart. So when somebody says, I have a heart condition, usually, almost always, he means there is a disease of the blood vessels of the heart. Okay. Now, when we are looking at disorders of the heart, we need to classify it a little bit. The first one is inherited conditions. In inherited conditions, where they are, let me show the diagram here. The blood vessels are placed in a different position. And so what happens is, the whole pump doesn't work the way it should. Some of them can be corrected by surgery, but many of them you can't. So the child, if it is born, it may survive a couple of years and die because the heart cannot cope with a growing child. The next one we have is the valve, which again requires surgery. This one cannot be treated medically. Now the heart also has nerves through which electrical impulses go, and this firing of impulses controls your heart rate. Now when we exercise, the firing is faster and therefore we have a higher heart rate. Then we have other disorders which are related to the muscle. Some people can develop a degenerative disease of the heart muscle. Again, this problem cannot be easily treated. They do not last very long. Okay. Now, since we have looked at all the other possibilities, all these possibilities make up hardly 3%. 97% are diseases of heart vessels. The picture that you see here is the picture, or rather an X-ray picture of a heart where a dye has been injected into the what you see. Now before we come to this complicated picture, I want to show you the outside picture of a heart. Now as you can see, it is quite complicated to try and make out which vessel is what, which chamber is what. Now it's a very efficient pump built in such a way that it fits into your chest and takes up very little space. Now as you know, the heart pumps out blood through these vessels into all parts of the body. But the heart muscle itself has its own circulatory system, as you can see here. You will see three main arteries. So when the heart is contracting, it supplies blood to the body. When the heart relaxes, then blood flows into these vessels. So the heart gets its nutrition, oxygen, when it is relaxing. Now if the heart rate is very high, the relaxation period is short, it may not get all the nutrition and oxygen that it needs. Now these are the vessels that get blockages and reduces the efficiency of the whole heart. The next question could be, why the heart vessels? We don't seem to get the same blockage in other vessels. Why the heart? And this is a $67 question because we don't know. We know that it occurs and we can relate some causes to it. Now before that, I want to show you another diagram to highlight the fact that the heart, though it's a pump, it's actually two pumps connected together. The blue that you see here is the used up blood that comes from the rest of the body into the right side. From here it goes to the lung, gets oxygenated and comes into the left side. Now this is the blood that the body needs, and it is from here, it is pumped out through the red color vessels into all parts of the body. Okay. Blockage. Do you, sorry, what are the causes of blockage? Of course, anyone can say this reason, that reason, and so on. But the ultimate thing is we really don't know what happens. Let me give you an example. Everybody says cholesterol is the cause for blockage in heart vessels. Why doesn't it block the vessels in the arms and the legs? Why doesn't it block the vessels that go to other parts of the body like the liver or the spleen? Almost always no blockages occur in these areas. Some of us might say blood pressure. Again, the same reasoning. Why only the heart vessels? Let me go back to the diagram where it shows the blood vessels. You will see many branches, but you see three main vessels. This is the right one, this is the left one, and the middle one is actually going behind the heart. So we have three vessels sitting on the heart like a crown, and that's the reason it's called coronary vessels. Coronary is basically crown. So, okay. Now, having said, we know there are certain conditions that are associated with heart disease. And since we know only that, we need to look at that. Now, I should have said associated cause of blockage, but I'll just leave it at that, cause of blockage, because this is the only area that we can work on. It has been found that if you have high blood pressure, there's a higher chance of you getting heart disease, or rather coronary artery disease. Let me reiterate again here. Some people, not a majority, some people, even with an elevated blood pressure, do not have heart disease. So apparently it is not just high blood pressure. There's something going on in the body which is causing it, but it's working out through the blood pressure and other causes listed here. There are some very fat people who have no heart disease. And I'm sure you can tell me that there are some thin people who have very bad heart disease. But we must also realize that obesity statistically shows that we can get a heart disease more easily. Now here is one condition that is very definitely associated with heart disease, diabetes. If I were given a choice here and that I must have at least two diseases, I will choose hypertension, high cholesterol, not diabetes. Of all the causes here, diabetes is the worst. Diabetes is a condition where the sugar level in the blood increases beyond normal levels, and because it is in the bloodstream which supplies all the tissues in the body, all of them get affected. Their efficiency drops, and organs that are critical will show the first, which means heart, kidney, and your eyes. It also affects all other organs. Your muscle size decreases, your internal organs decrease in size, but because you don't feel very much different, you don't relate to it, but when your kidney begins to fail or your heart begins to fail, you feel the difference. So diabetes is one out of this condition which is 100% related to heart disease. Now cholesterol, this has been very controversial. People with high cholesterol seem to have blocked arteries. But then it is interesting to know that if you have 100 people who have heart attacks, 50 of them have normal cholesterol. So cholesterol is a risk factor, but not all the time. But try not to take the decision yourself. You better see a qualified medical practitioner to decide that in the light of your physical condition. Now, there are two other areas which are related to everything else, and that is basically stress and lack of activity. Now, stress is a very big topic. A lot of people say many things. There is cut down your stress, eliminate stress. There are seminars on it, but the truth is all of us live in a situation where our jobs, lifestyle cannot be changed, and therefore stress levels cannot be reduced. So the only thing we can change is our attitudes to the stress and see if we can manage the stress. Here is another risk factor that you can modify definitely if you put your heart to it. Most of us do not move around enough, and therefore we need to be involved in some activity, physical activity. I remember talking to a young man and asked him whether he does any games, and he very seriously told me, yes, I play computer games. Now, he was serious. He didn't know the difference between normal games and computer games. Our society has come to a level where there's so much ignorance on this. Now, activity simply means that exercise is just planned activity. So some people say, oh, that's so boring. And I must say it is. So you choose the one that is interesting to you. You can have a different activity every day. Maybe walking today, tomorrow jogging, third day swimming, fourth day badminton with a friend, but some activity every day. So these are the major associated causes, and diabetes is a definite predisposing factor. Okay, someone has got heart disease. What do they go through? First of all, they already have the heart disease. Changing their lifestyle and all that is important, but something has to be done quickly to control it. And there is no other way except to go through these three procedures. Some can be controlled with just medication. Now, it doesn't mean that they don't take care of themselves because the medicine is now giving them relief from heart disease. No, it's very important to change other things too. But this is the first step. Now, some people go on the medication, they feel better, but after a while, the symptoms return for various reasons. So they have to continue with the medication and go on to some simple procedures like angioplasty, where a tube is introduced into the blood vessel and a small balloon at the tip of the tube is used to open up any blockages. Now, I say it's a simple procedure now. 15 years ago, it was a very risky procedure. Even today, it carries risks, but the risks are much less. Why? People have been specifically trained in this procedure. The catheter or the tube that is used for the procedure is much thinner, smoother, and better quality. Now, some of them are able to get relief with these procedures. Unfortunately, some come in with such a bad situation that they have to have medication and go on to major surgery. There is only one kind of major surgery for coronary artery blockage, and that is bypass. So the blocked area is bypassed by fixing a new blood vessel before the blockage and connected to an area after the blockage. This blood vessel is chosen and taken from your own body. It could be from the legs, it could be from the arms, it could be an extra blood vessel behind the chest wall. If you take somebody else's artery or blood vessel, it will not, your body will not accept it. So it has to be from you. Some have gone on to their second major surgery. For example, our former Prime Minister of Malaysia, Dr. Mahathir, has had his second bypass. Because these are bypass extra channels, they do not last very long. It could last anywhere between 1 to 2 years up to about 20 plus years, depending on how well you have looked after your health and how lucky you are. So when it comes to treatment, these are the steps. For the severe cases, all three can happen together. Now, you haven't got heart disease, or there has been an early diagnosis made. You want to minimize it, and for those who don't have it, they want to prevent it. Now, if you ask me for the steps, I will crystallize into just two things: diet and the way you conduct your lifestyle. Now, food is our ingredient for energy, but it also carries nutrition for repair, regeneration, and rejuvenation. So eating the right kinds of food is very important. If we look at the animal kingdom, you will find animals do not get coronary artery disease. However, animals that have been domesticated, cats and dogs, get coronary artery disease. And this includes even some very healthy animals. I have a friend who has an in-house monkey. He was fed on a home diet right from small. That monkey has developed diabetes and he is on insulin injection. My friend is very attached to that monkey and they take very good care of him. He gets a jab twice a day and he's okay, but you don't get diabetes in monkeys in the wild because their diet is quite different. So we need to look at our diet. Having said that, the human diet is probably one of the most varied, and we also eat not just for survival but also for pleasure. So there is a wider range of diet that our bodies can manage. Nevertheless, all of us know what should be avoided. For example, to tell in a broad way, excessive oil, excessive sugar. If you have to simplify it, that's it. You can eat almost any food that you want. If you have minimal oil and hardly any sugar, you're on the right track. Of course, in this part of the world, another major fault is we eat too much. Now, the first thing to do would be cut down the amount of food that you eat, and then you cut down the oil, and lastly, you can cut down the sugar. Don't hurry. Give yourself a 2 to 3 month period to modify your diet. Many of us do not enjoy our food. You might be surprised at that statement. But if you see some people eating, they eat so fast, how can you enjoy your food? Take time to chew your food, enjoy what you are eating, and you will find that you feel better and you can avoid a lot of these problems. Now, if you look at lifestyle, we are looking at just basically two things: activity and rest. Are you getting enough sleep? It's very important, particularly those in Singapore. Your high-rise buildings are all lighted up all the time. I don't know whether you get restful sleep at night. Okay, you need to sleep in a dark room. 1/3 of your life is spent sleeping, 7 to 8 hours. So if you live to 75 years, you have slept for almost 25 years. Now, any activity that involves 1/3 of your life must be important. So make sure that all the benefits of the sleep can be reaped by having adequate restful sleep. The other area is stress. Now, this is an area which is very difficult to advise. All I can tell you is manage the stress the best way that you can. Let's look at some of the details on both. The diet first. When you read the magazines, papers, listen to programs, vegetarian diet is good. Another group says you must include meat. A third group says follow the guidelines according to your blood group. There are others who say test for food intolerance, and you must follow that very carefully. Now, for an average person, this is a lot of information to crunch, to be able to analyze and follow. I would suggest that you take two simple measures. Choose the foods that are healthy and choose the diet consisting of these foods that you feel comfortable. You may be eating healthy food like eggs, for example. Eggs are very healthy. But if you feel uncomfortable after eating, it is not for you. All our bodies are slightly different from each other when it comes to the biochemistry. So you know what foods are healthy, but then again within that group, choose only the ones that you feel comfortable and enjoyable. This is a topic that is very difficult to cover. There have been seminars, teaching forums. Many companies have invited experts on this, and the net result is there is more stress, because it takes a lot of stress to find out about stress. Let me put this in perspective. Stress is a process that helps us to adapt to a higher level of function. Stress is a process that the body and the mental part goes through to adapt to a higher level of function. Sometimes we need more time to get over it. You have to plan to get over it. Try to plan to overcome the stress by solving problems, not reducing the stress. Most of the time we can't reduce the stress that is in our environment. Okay. The second one we talked about is exercise. I think you know about this. One important thing I'd like to stress is too much exercise is bad. Too infrequent exercise is harmful. So when you get into this, commit yourself to short periods of daily exercise. Many people think that if you miss it for 3 days, the 4th day you spend 2 hours exercising, you can make up. No, you produce more free radicals in the body and you accelerate your aging process. Look at the workers who work on the road. They are exercising. They exercise 8 hours a day. Have you seen a retired road worker? At the age of 55, he looks 70, worn out and old. Why? Too much of physical activity without the adequate nutrition. So your exercise should be what suits you. You eat every day, you exercise every day. You'll be surprised. The more you incorporate into your lifestyle, your ability to manage stress is better when you exercise regularly. This will contribute to preventing, reducing, or if you already have coronary artery disease, it will stop at that level. This is just to remind you, when you can, take only stress that you can handle. Why I say this is, many of us don't know how to say no. In our Asian culture, when we are loaded with more work than we are supposed to do, we find it not polite to refuse. So we need to think about that and very gently or genuinely tell that you can't take on this because you already have enough. This may take some time working it out because all of us work in different situations. Again, one part, how do we know I have enough? The key word is you must be pleasantly tired, not exhausted. If you have done any physical work that exhausts you, exercise that exhausts you, you will not be functional the next day at work. It will cause more stress, you become irritable at work, and so on. So just the amount of exercise where you break into some sweat and leaves you pleasantly fatigued. Now, if you think those are the factors for heart disease, let me say there are many other unknown factors. Too many to cover here. In the list drawn out by WHO, World Health Organization, even an argument with your mother-in-law can cause heart attack. Lightning suddenly striking near you when you least expect it can cause a heart attack. Someone telling you something very unpleasant in a very unfair way can possibly cause a heart attack in someone who's already got blocked coronary arteries. So there are many unknown factors. Now how do we avoid it? Take life at your stride. Oh, that's much easier said than done. Now the key word there is at your stride. Don't try to follow somebody else's pace. Follow your pace. If there is a particular work that your friend can do in 1 hour and you take 3 hours to do that, don't worry. There are other areas you are probably faster than him. We come across people who study once and can remember everything. We have to study much longer to remember. Okay? Don't feel stressed. Your friend probably learns faster and also forgets faster. You may remember it longer. So for every negative or shortfall that you have, you do have a positive. So take things at your own stride, both in your work and your relationship. And one of the unknown factors is they find those who have a strong religious faith, a strong fundamental religious faith, tend to live longer. It seems to make it easier on their heart. Maybe because they unburden their worries to something stronger than them. If you think you want to have reduction in your heart disease and you take up religion, it doesn't work. It has to be a genuine outpouring. Okay. Now, the heart is a mechanical pump, but it is also a living organism. Apart from the wear and tear and the abuse it takes, it requires for maintenance good nutrition. So you need to provide the right nutrition, and if you provide it in abundance, it may help to withstand all the wear and tear during your lifetime. Now that involves taking vitamins, minerals, antioxidants. I have not listed here. You also need omega-3 fish oil. Okay. Now this has to be obtained from your diet. If your diet has a shortfall of all this, you will not fall sick immediately. There will be an overdraft that develops in your body which accumulates over years, and all changes in tissues come over a period of years. By the time you show the ill effects of the coronary blockage, it has been going on for years. Do you know when the blockages start in our heart, in our blood vessels of the heart? It has been shown by post-mortem that it is already present in the early 20s. Now, that might shock a lot of you, but the fact is it's true. So, those who are parents now, you need to start with your children now. Don't think that you are doing them a favor buying them all nice kinds of food, but which are actually harmful to them. Now, those of you who are in your 20s, don't think that you will take care of your body when you're 40, when you're a little older and you enjoy now. What you do now will reflect later in life. For those of you who already have heart disease, I already got it now, no point of looking at this, not at all. If you take care, the progress of the coronary artery vessel blockage can stop at that stage, and in some cases even regress, in other words reduce. It has been shown by angiogram that if you are very strict in your diet, even if you have a major blockage, it can shrink. It will not disappear 100%, but all you need is a little shrinkage, and the amount of blood that can flow through increases, say by 15 or even 20%, can mean life and death. To make sure that you get your vitamins, minerals and antioxidants, you need to take a supplement, simply because the diet that we consume nowadays has many handicaps. You are not in one place. Most of us work and we eat in different places. Sometimes we get good nutritious food, sometimes we don't. We just eat to fill our stomachs, and therefore shortages can occur. To be absolutely sure, you should take a good quality vitamin, mineral, antioxidant support, so that you know for sure that you have got it. This is not a license to take the supplement and then eat what you want. No, but just to make sure that you get this every day. Now, the only product in the market in Southeast Asia that I know of, where all these three are combined in one and in liquid form to give you the maximum absorption and put together and has been tested on human beings, in other words, clinical studies have been done, is a product called Vemma. I think most of you who are attending this seminar are already familiar with this. Now, this is not just a sales pitch, but rather a true fact. The minerals that are present here, 65 of them roughly. Why I say roughly? Because it is vegetable extracts. Now, that number can vary from 62 to 65. So these are not only minerals, but minor minerals and micro minerals, which are absolutely essential to the body. They also have 100% of vitamin A, B, C, D and E in one serving. Now, the antioxidant properties are extracted from a variety of natural sources. 3 that are used by Vemma. Number 1 is mangosteen. Number 2 is aloe vera. Number 3 is green tea. All 3 have been shown to be beyond doubt a source of a wide variety of antioxidants which are healthy to the body. This is arguably the most powerful liquid antioxidant product along with minerals and vitamins. And I would urge you, to all of you, to take your regular serving per day. It's a pleasant drink. People of all ages can take it, and it will be a powerful tool along with your diet and lifestyle to prevent coronary artery disease. Now, I've been talking for quite a while. I'm going to stop here. We already have some questions that have come in, and I'm going to address these questions. The first question is, I think they wrote a little earlier. So, what type of food supplement should we take to avoid heart disease? you must take all basic supplements. Every nutrient is involved in giving us good health and preventing illness in all our organs, including heart disease. Now, the closest I can get to a good supplement which provides all that is Vemma. My customer has recovered from stroke 2 years ago. After he started consuming Vemma for 2 weeks, he does not have much improvement. Okay, now thank you for this question and the info there. This man had stroke 2 years ago. When you recover, a stroke is literally a heart attack in the brain. There is blockages of vessel and some parts of the brain may die off. Now, recovery can go on up to about 1.5 years. After 2 years, all possible recovery has happened and further recovery is not possible. So this man has been taking Vemma. He doesn't feel any better. Should he stop? I would say don't. Someone who has had a stroke has a greater chance of having a second stroke. And if you continue taking good nutrition, you may prevent it, and you may, if there is no choice, the body condition is so bad, your second stroke may be pushed to a much later date. And of course, someone who has a stroke must have a number of medical problems. Please make sure that you follow all the instructions of your doctor in treating and controlling those risk factors like blood pressure, diabetes, high cholesterol, and so on. Now, the next question is heart disease inherited? And I take it that they mean coronary artery disease. My parents both have heart problems. Will Vemma help? Now, heart disease, to some extent, is inherited because we inherit the biochemistry of our parents. But most of the time, we do not inherit coronary artery disease. What we inherit is the eating pattern of our parents who brought us up. So when you continue with the same pattern, you will get the disease that your parents had. And if this patient says, both my parents have heart problem, it would be interesting to find out whether their parents had any heart problem. And usually, the grandparents didn't have that. What happened? During the time of our parents, eating patterns have changed quite a lot. And we inherit those eating patterns. So change your diet appropriately and take Vemma. Yes, it will help to prevent and maybe slow down heart problems. My son is 7 years old and doctor said he has arrhythmia. What is your advice? A 7-year-old boy having arrhythmia. Arrhythmia is a condition where the heart rate goes up to a level where it cannot experience a complete contraction. So here is a situation where there is a nerve problem to the heart. The nerve is firing too fast and the heart, before it finishes the contraction, has to have another contraction. So it does not complete its contraction and the rate goes up. There are major risks involved with this, and the patient must be under medical treatment. There are drugs, medications to control this. They must take it. Why is the nerve firing faster than it should? Sometimes it could be due to a lack of appropriate nutrition. Sometimes it may be some fault in the nerves that go to the heart. Now, taking adequate nutrition can support the body in trying to repair as much of it as it can. So I would say give this boy, 7-year-old boy, a full serving of Vemma every day. My grandfather is 80 years old. Recently, doctor confirmed that he has 3 blockages in his heart, but he is too weak to go for surgery. Is Vemma helpful? Please remember, Vemma is a food supplement. It is not a drug. It is not a procedure. The blockage remains. Now, your grandfather is 80 years old. At that stage, their ability to eat and process the food that they eat and obtain the nutrition required to maintain a handicapped heart is very low. He should be going on 2 servings of Vemma per day. 1 serving in the morning, 1 serving in the afternoon. This way you provided the maximum nutrition that the heart, which is already old and blocked, needs to function. If he finds difficulty, he will have to undergo treatment, whichever the requirement. But whatever treatment he gets, the outcome of the treatment will be better if the nutrition is good. And I would suggest 2 servings of Vemma. My customer felt a little sign of stroke after consuming Vemma for 2 weeks. Now, this is definitely a coincidence. Now, Vemma is a food supplement. If somebody tells you, I took a little food and then I had my lunch and then I had a stroke, nobody is going to advise the member, don't eat food anymore because you got it right after a meal. So when you look at Vemma, what you have is vitamins, minerals, antioxidants from known vegetables and fruits. Now, how can that be harmful? Now, there are no herbs there are no chemicals. In fact, Vemma is so particular, we don't even put in preservatives or coloring matter, taste enhancers, and so on. So, if the patient has a sign of stroke, please ask him to see a doctor so that he can zero in on the actual cause of it. My father has undergone bypass 5 years ago. What is the best dosage of Vemma so that he doesn't need to go for bypass again? Okay. Now, 5 years is a good time, which means the bypass vessels are working well, and now you have to really take care of his health. I'm sure he's on medication. Make sure he takes it regularly as regular checkup with his cardiologist. Okay, now he has to take nutrition to support his wounded heart, which means he has to take some supplement. The best that I can think of would be Vemma. Now, will that cure his heart problem? No. Will that prevent it entirely? No. Vemma supplies nutrition, which is one strategy. He has to do a little bit of physical activity, must keep his cholesterol under control, lose any excess body weight, cut down his stress level. You can see that there are many other things that he has to work on. Vemma supplies 100% of the dietary requirement. What should we do when we know that we have heart disease? How can I know if I have one? Okay. The first thing is to make sure you go for a checkup. I would say have a blood profile done every year so that you know where you stand. Now, if you suspect you have heart disease, probably you have some symptom. Maybe you tire easily, maybe you get palpitation on climbing staircase. In that case, you need to have a checkup. I am scared because when they check up and they find something, it's a problem. Now let me tell you, when you have something that has gone to an advanced state, you will be even more scared. So go for a checkup. Let us assume everything turns out normal. Excellent. Keep those records, because next time when you check up, if there is a change, your first test is the only one that you go and compare with, and you will know what are the changes, whether these are the early stages, and you can start working on it. My nephew is 16 years old, has a pacemaker since he was 10 years old, that means 6 years on a pacemaker, beside a heart transplant, any other way to help his heart. Okay, here the diagnosis is not given. I'm assuming that since a heart transplant has been discussed, he must be having a condition where the muscles of his heart have degenerated. Now with such a situation, there is no choice but for a heart transplant. And that one you need to have a donor that is appropriate, and heart transplant advanced quite a bit, and there is one even US vice president, a past vice president, who had a heart transplant, and just about 2 weeks ago I saw him on an interview on TV. He looks as good as normal, so things have improved. Of course, this is a very young boy. If the heart transplant is successful, his growth can be almost as normal as any other child. Some studies show that oats is good for the heart. Is that true? Very indirectly, oats directly reduces your cholesterol level. So if in your case cholesterol is a risk factor, yes, it is good for your heart. Now when you take oats, make sure that you take raw oats. Some of the processed oats do not have adequate soluble fiber that will do the job. So not any oats, raw oats which may have to heat it to a high temperature, takes a while, take that effort. Ready-made oats or pre-processed oats, not all of them can do the job. What is the symptom for heart attack? Very good question, very difficult to answer. Classical symptom, pain on the left side of the chest. How do you know it's a heart? Not the muscle, not the cartilage or bone. Now, surprisingly, a heart attack when it occurs, even if it's the first time, the patient knows. Along with the heart attack, the pain includes a complex where the person who is experiencing it will get a feeling of impending death. Quite frightening, isn't it? Thank God for that, because if you have it the first time, the patient knows. Okay, this is the common one. Now, the other ones in decreasing order of common occurrence, pain radiating from the chest to the left arm, pain in the neck area, pain in the stomach area. I have also seen a patient who came in with a toothache on the left side. That's it. And later it turned out to be a heart attack. Now those are very rare. Okay. Some people have no pain at all. The only thing is they sweat. That's it. Now, wow, I also sweat a lot. So how? So this sweating will be so profuse, it will soak the shirt, and there can be no pain at all. So it's a varied kind of picture. Now, how do I make out which is which? Now, that's not an easy question to answer. That's why I say it's a good question, but difficult to answer. Now, just fall back on how the patient feels. Many people who don't go to hospital, there is a certain kind of feeling they get. They say, take me to a hospital. Now, when that happens, even if the patient looks good, take him to a hospital. He knows what's happening in his body. Okay? If the patient is on dialysis, will Vemma help? Now, this is one condition where Vemma has to be taken with the consent of the treating doctor. You see, in dialysis, your kidney has completely closed down. So, no waste matter gets out except through the dialysis. And Many doctors are very wary of supplements for patients who are on dialysis. Personally speaking, a dialysis patient should take Vemma, and I can repeat that for you. Someone on dialysis should take Vemma. What is Vemma? It's food. Vitamins, minerals, antioxidants, it's food. A dialysis patient is very weak, and in the dialysis process, it is not just waste matter that comes out in the machine. It also filters out a lot of minerals which has to be replaced. So if you have to show Vemma to the doctor, when you show, don't just show the bottle. Take the contents, list of contents, have a discussion with the doctor, and I'm sure they'll be willing to help and support you. What is the best serving for a fourth stage colon cancer? Now, if your colon, any cancer for that matter, if it is in the fourth stage, nothing is going to help. Whatever you do will make the patient more comfortable. Traditional treatment, alternate therapies, nutrition is going to make the patient more comfortable. And for that reason, I would say you must give. Someone in the fourth stage of colon cancer, they've undergone maybe surgery, radiotherapy, chemotherapy, and their general condition can be terrible. Additionally, they lose their taste, no appetite. At a time when they need extra nutrition, they can't even get basic nutrition. So the only way to give it is in a concentrated form where the body doesn't have to process a lot. What better supplement than Vemma? It has got all the three important components. It's in a form, liquid form, which is easily processed and absorbed, and it has been clinically tested that actually gets into your bloodstream and makes you better. Let me make that clear again. It's not going to cure the cancer, but it helps the patient, the cancer patient, to get nutrition to his normal cells to make him feel better. Are there any more questions? Doctor said my heart is weak and needs more good cholesterol. Is omega-3 and 6 good for the heart? Now, look at the cholesterol profile. The cholesterol must be within normal limits. The bad cholesterol must be low. The good cholesterol must be high. The only way to get good cholesterol high is to exercise. Okay, when you exercise, get the good cholesterol up, the bad cholesterol also comes down automatically. Now, omega-3 will help the process. Omega-3 by itself will not help. Okay, so as a final take-home message, I want to reiterate that food supplements are very, very important for people with heart disease. Just because they are on heart disease, they have heart disease, many restrict their foods, and in the restriction, they might without getting the nutrition that they need. The easiest, proven, most easily served supplement in the market today is Vemma, and I would urge all of you to help these patients to take it and take it yourself so that you can prevent this disease. Thank you very much. I will pass it over to Verlin again.
Right. Thank you, Doctor, for a wonderful presentation. Wow, so much tips that I have picked up from tonight's topic in order to take a good care of my heart and to live healthily. Well, till the next time we meet in this room, we will have another session next week, 28th of November, Thursday, all the way from Taiwan in Mandarin, with the topic as hydrate your body. Right, good night, fellow brand partners, and till we meet again, thank you and take care.
If you are diagnosed with CAD, your doctor will consider two approaches to treatment: medical and surgical treatment. The first treatment uses medications such as cholesterol-lowering drugs to reduce the buildup of plaque in the heart's arteries. Aspirin or antiplatelet medicines to reduce the blood's tendency to clot and to block arteries. Beta blockers to slow the heart, which decrease your heart's need for oxygen. Calcium channel blockers, which relax the muscles that surround your coronary arteries and allow more blood to flow to your heart. They also help control high blood pressure. ACE inhibitors, which allow blood to flow from your heart more easily, decreasing your heart's workload. Finally, diuretics lower blood pressure, which decreases the workload on the heart. You may need to take one or more of these drugs every day depending on how advanced your condition is. If your symptoms are severe, your doctor may also recommend surgery to improve the blood flow within your arteries. The most common procedure that you may have heard of is called angioplasty. This procedure is used to open a severe blockage. Here's what happens. A small incision is made near a major blood vessel, so your doctor can insert a tube called a catheter and thread it up towards the blockage. At the end of the catheter is a balloon which is pushed to the spot of the blockage. The balloon is then inflated. Sometimes a wire mesh tube called a stent is put in place to help keep the artery open. Medications embedded in the stent lower your risk of developing a new blockage. If angioplasty doesn't solve the problem, you may need another type of surgery, for example, heart bypass surgery, which creates a new route for blood to flow around the blockage in the artery. Your cardiologist is the best person to evaluate which of these and other treatments are best for you. I hope the information I've given you helps you explore your options with your doctor. And don't be afraid to ask questions. CAD is the leading cause of death in both men and women in the United States. Make sure you know whether you're at risk, watch for symptoms, and try your best to make healthy choices. Thanks for being a part of Healthy Nation. Be sure to watch other videos and get talking about your health.